I have had 5 open heart surgeries and 36 others. Recently, I had a heart transplant.
He really struggled with receiving a transplant, knowing it was going to come from another kid. He went through a lot of stages where he would want his transplant because, of course, he'd want to feel better, but then the next day he wouldn't want it because he knew that another mother was going to have to grieve their child for him to live.
I am the parent of a young adult with congenital heart disease.
I am living with congenital heart disease.
This organization has given me and my family an avenue to advocate not only for our son, but also for all individuals with congenital heart disease.
Congenital heart disease is the most common birth defect. 1 in 100 births have CHD, with more than 3 million patients living in the United States. There is no cure. CHD is a lifelong disease requiring ongoing specialized care.
Our mission is to conquer congenital heart disease. We started out in the advocacy space, originally as the Pediatric Congenital Heart Association. We quickly grew into education resources, support networks, and now we're getting into the research area. We really want to improve outcomes and improve quality for all patients and families.
What I love about this organization, one, is its energy. This organization, it cares so passionately about what it does. Its advocacy work, its focus on transparency, its focus on building relationships and collaborations.
What makes Conquering CHD different is that we all have a connection to congenital heart disease. We're patients, we're families. Anyone who's on the board, who's a staff, who's a volunteer, has a connection or a family member who has congenital heart disease.
And I think that this organization encompasses everything that families need. There's education, there's support, there's advocacy, there's research and relationship building all across every avenue of the CHD journey.
They really do try to meet the families where they are. So, for example, going into the hospitals to make sure that patients and families know and understand the resources that are available to them. They have state chapters, they have national chapter. They also have a wealth of information available online.
I've gotten involved with this organization because I go back and think about the stress that I felt and the questions I had. And this organization has made a commitment across the board to being able to assist those families that were much like us.
This organization gave me the tools and the ability to give back to the community, and I don't think I would have been able to have the impact that we have without them and without their support. So I'm very grateful for that, and I want to keep supporting the mission and being a part of this organization.
When your child is first born with a congenital heart defect, you feel alone and isolated, and having a community of support is just somebody there who you can relate to and vent to, share stories with, and our local community, really just, they're part of the family.
With that prenatal diagnosis, all the way even to through adulthood and maybe even experiencing a loss, these families need support and resources every step of the way.
You know, CHDs don't care about your race, your religion, how much money you make, you know, where you come from. And I think it's important to realize that, you know, that there's children with CHDs and adults with CHDs. And I think one of the important things is that we're a very diverse group and we try to span across a very diverse group.
If we don't stand up and create these vital resources for patients and families, they simply will not exist.
We're advocating for everyone with congenital heart disease because it affects them along their lifespan. It is the most common birth defect. There has to be some place for them to get resources and support along their journey.
When I was a kid growing up and when my parents were young, there was no support. There were no groups out there to help patients and families get information or to feel like they weren't alone in the journey. So now we're so lucky to have other people that we can talk to who've been where we've been and who can understand what we're going through.
So as a CHD patient, I really hope for the future that children and families affected by CHD, no matter where they live or how much money they make, can have the same access to quality health care, education, and support.
When somebody says, so is that it for your son? Is he good now? I can never say yes to that, and I just really hope that someday we will conquer CHD and I can say, yeah, that's it, we're good now.
Together we are conquering CHD.
Together we are conquering CHD.
Together,
We are conquering CHD.
I believe that fighting congenital heart disease requires a concerted effort by everybody put together. The important piece that has always been missing has been the patient and the family.
The medical professionals bring the expertise that's important to know what decisions should be made, but the parents bring their passion and they know their kid, they know what their child needs. And then the patients, it's important that they bring their experience and share what's really going to work in everyday life.
It's important that patients, families, and medical providers collaborate, because that is the way we really get things done as a group.
This collaboration has led to the development of the Guided Questions tool, a resource developed by the patients and the medical professionals that allows patients and families to ask the right questions to determine the best course of care.
By collaborating with medical centers in their local communities, state chapters provide Conquering CHD kits to families and patients in the hospital.
When we were inpatient right after Miles was born, we received a Conquering CHD kit, and it came to our room in a beautiful canvas bag, and the Guided Questions tool was inside of the Conquering CHD kit, and it kind of felt like it was sent to us in a very serendipitous moment. We were very thankful to have gotten that. Within the Guided Questions tool, a huge topic was about transparency and outcomes for our center. And I remember asking the surgeon about the success rates and some of the risks that came with it. And actually one thing that we found out through asking that was that the particular surgery that he was about to perform hadn't been as successful just 15 years prior. So even though we might not have normally asked the question, we found out an answer that really impacted us.
When your provider gives you a guided question tool and he says, look at the questions there, and please ask me those questions, because I want you to know the answers to those questions as we go on this journey of congenital heart disease cure together, it puts them on a different platform. It suddenly gives control back to the families who deserve it in every way, form, and fashion.
Our patients and families continually ask for more information and to be fully engaged in healthcare decisions. We've developed tools to help them make the best decisions.
Another way we are achieving transparency is with the hospital navigator. So parents and caregivers will be able to go online and see what hospitals are near them, and then they can kind of look over to see what place may fit their needs best.
It is a first of its kind, compiling surgical outcomes from hospitals across the country and presenting it in a format that patients and families can easily understand.
That is a tool that a family in a very rural community can access just as easy as someone who lives in an urban area.
Transparency to me was hugely important. It literally meant life or death for my son. Once we were able to get to a hospital that understood this and thrived in transparency, my son was able to thrive.
We can't move forward if we don't share what information crosses every avenue. You need medical facilitators to talk to families. You need a parent to be able to talk to another parent. You need to have a patient meet a patient. You also need all of those people to talk to your lawmakers so they can make sure that we get the research funding that we need, make sure that all of the policies are in place so that these hospitals are transparent with one another and they share their information, and that each of these parents know where they can go to get this information for their children. Patients can get the right information as well from all of their medical providers.
Each year, patients, families, and medical professionals advocate together for increased federal research funding in Washington, D.C.
And so I want to be in DC to advocate for the funding that we need to find more cures.
State chapters host educational events. We include local doctors. We also provide inpatient meals to families in the hospital, and we host social events for families outside the hospital so they can relax and just be a normal family.
The care bag that we received was a blessing in itself. Ryan was so thrilled with Echo the owl. She slept with Echo every single night, and she still sleeps with him in her crib every night.
I started our chapter because I don't want parents to feel like they're alone. I don't want a single heart family to feel like they are isolated and that they are walking this road by themselves, because it is too hard. With the life we live with our kids is too hard not to have a support system that really understands what's going on.
We're working as an organization to fill the gaps in resources available to teen and adult patients and through the process of transition. I'd like doctors to understand that we're not just another adult who's sick, that we've spent our lives in and out of hospitals, and that's why transition into adult care is so important.
People should turn to us because this is a place where you will find a community that is here to support you, that is here to walk this CHD life with you. And this is why it is so important to be able to connect with others so you can educate yourself, give yourself knowledge, and become a voice.
Now is the time to use your voice to fight for those who are living and those who we've lost to CHD.
Good evening, everyone. Orlando Health Arnold Palmer Hospital for Children is committed to helping patients and families with congenital heart disease. All of us at the Heart Center at Orlando Health Arnold Palmer know that compassionate family-centered care, along with advanced individualized treatment options led by our experts, empowers families to be active members in their child's healthcare process. We're so grateful for your trust and for allowing our team to be part of your journey. We also know that by partnering with incredible organizations like the Pediatric Congenital Heart Association, together we can conquer congenital heart disease. Thank you and have a great evening.
Hello, and thank you for joining us tonight. My name is Peace Midwamy. I'm a cardiologist at Nemours Children's Hospital in Orlando, Florida. Here at Nemours, we focus on the early detection, repair, and management of cardiac problems to help give kids of all ages the best chance for a healthy future. From our dedicated clinicians to the brand new innovative design of our new cardiac center, we are committed to each and every child facing congenital heart disease. We are able to change the lives of so many families impacted by CHD through our commitment to constantly improving cardiac outcomes, combined with our partnerships with wonderful organizations such as Conquering CHD. Caring is contagious. Compassion and collaboration are also contagious. Thank you for coming together tonight, even virtually, to celebrate and strengthen the CHD community. Together, we will conquer CHD.
Together we are conquering CHD.
Together we are conquering CHD. Together we are conquering CHD.
Hey everyone, it's Michaela McLean, Miss Florida. I just wanted to say a big hello to everyone in Florida and around the country that are a part of the Congenital Heart Virtual Event tonight. Your support means so much and will help patients and families affected by CHD. Welcome and thanks for helping us conquer CHD.
Thanks, Michaela, and welcome everybody. Thank you for joining us virtually. I wish we could be in person like we were supposed to back in March, but at the same time, we're glad that you're here and glad you're celebrating this night with us because it is important to all our patients and families that we represent with congenital heart disease. So thanks again, and I'll introduce myself. My name is David Kasnick. I'm the Executive Director and co-founder of Conquering CHD. And now I introduced Amy, my co-founder.
Hi, I'm Amy Baskin. I'm also the co-founder and director of programs at Conquering CHD, and I'm the parent of Nicholas, who's now 15 with complex CHD.
And like Amy, I'm a parent of Piper, who's 17, born with several VSDs and transposition of the great arteries. We had an arterial switch when she was 5 days old, and it took us 6 weeks to get out of the hospital. We almost lost her, and honestly, it was the most traumatic thing, and I never wanted anything to do with congenital heart disease after that. And it really took me the next 9 years to wake up to the fact that this is a lifetime disease, and I need to be there to advocate for her and other people like her. And I met Amy at an event in Washington, D.C. around advocacy for congenital heart disease, and was really energized, came back from that event and thought I wanted to be involved in something in the advocacy space for pediatric congenital heart disease. So I couldn't find anything. I called Amy and I said, I think I want to start something. She said, great, I'll start it with you. So she quit her job. We started this organization as the Pediatric Congenital Heart Association, as you've heard previously. Most recently, we changed our name to Conquering CHD earlier in the year, mainly because we wanted to represent the patients and families that we already do represent. And that is not just the infants and people that we've lost to CHD, but also the millions of adults now that are living with congenital heart disease. So we're now a full-fledged lifespan organization representing everything from diagnosis through adulthood and even bereaved families, like you'll see some later on in the program. So we're really excited about our programming. We're in advocacy, education, research. As you heard in the previous videos, we're in the support areas with our state chapters as well. We're here for everybody to be a part of it. The inclusivity of what we have here at Conquering CHD is everybody's welcome. Everybody needs to have a place, and that's what we want to add to everybody's journey on this. And in fact, you know, none of us chose this journey of CHD. I didn't want to be there. Amy didn't want to be there. All the patients and families that we represent don't want to be there, but we're here tonight to help raise awareness for that, to help raise money so that we can add to the program, so we can add directly back to those patients and families. So I appreciate you being here. I appreciate your support of Conquering CHD, and I want us to have a great night tonight. Please enjoy it and bid as much as you can, as much as you feel possible, and look for those silent auction items as well. So I'll turn over to Amy now.
Yeah, absolutely. Thank you for the privilege of being with you tonight on behalf of Conquering CHD and all patients with congenital heart disease. So with your help and generosity, we are going to reach our goal. We're currently over halfway there. Our goal is $50,000. And we're more than halfway there. So keep bidding and keep engaging. There's many ways to get involved. If you haven't yet, hopefully you're watching us on your computer and you're bidding with your phone. Go back to one of the recent texts and you can hop online on your phone and start bidding. There's so many amazing silent auction items. Definitely check them out. There's something for everybody on there. Another fun feature we have is the text to donate feature. So if you're feeling generous and you want to do it easily, again, just hop on your phone and text. For example, if you text give 100 to the number 76278, you can make a $100 donation. If you want to text give 25 to 76278, you'll also give a $25 donation. You can donate as many times as you feel moved to this evening. Lastly, if you decide tomorrow you still want to donate, you can just visit our website, and at the top there's a great donate button. Our website is conqueringchd.org. We have, like I mentioned, a slew of auction items, and we understand because we're virtual, it's a little bit more difficult to figure out how to get your items. You don't get to just pick them up as you walk out the door. So we have scheduled a time for you to do that. The in-person items will be available on Saturday, November 7th. We will be mailing any certificates if you should win a gift certificate, and then we will email you any virtual items that you might be winning. Don't worry, you don't have to remember all of this right now. It's available on the home page. So if you click the event tab on the auction platform, there will be instructions about picking up your items. So I think we are ready to get on with the show. David, I'm handing it back to you.
Thanks, Amy. Well, we'd also like to take a minute to thank our generous individual sponsors, the Harding family, Drs. Diane and Frank Pigula, Trey Flynn, partner at NeJame Law. And also I want to thank the team, Rebecca, Amy, Jen, Jess, and all those others who had a hand in tonight's event. We couldn't have done it without you, and it's going to be a great night. So we appreciate all the support. And now I want to turn it over to Orlando's favorite talk show host, Johnny Magic.
Hey, I'm Johnny Magic from Johnny's House on XL 1067, and I was originally supposed to host this event when at the Four Seasons, but of course COVID came in, shut it down, but you know what? The help remains, and so I'm glad to be a part of this evening. We're gonna have a lot of fun, a lot of entertainment, and we want you to stick around and make sure that you help this amazing cause. Now, one thing we're gonna do is you're gonna see Echo the Owl and his thought bubble. Now, when you see that, you write the word down. And what's going to happen is at the end of the night, someone's going to get a chance at a $50 Amazon gift card. So when you see Echo the Owl, see the little thought bubble, you write it down. Now I'm going to help you out. The first word is Florida. You see it? All right. Now throughout the show, you write the word down, and at the end, there'll be a complete sentence, and somebody's going to win a $50 Amazon gift card.
Hello, everyone. I'm Dante Marcatelli of the Orlando Magic. And I'm here tonight because CHD is 30 times more common than cystic fibrosis and 50 times more common than childhood cancer. It affects people of every age, race, gender, and socioeconomic status. Your support tonight will help Conquering CHD continue to provide free resources to all of these people. So to everyone in Florida watching tonight, thanks for your continued support, and together we will conquer CHD.
Thanks, Johnny and Dante, and I appreciate those words of support tonight. Now I'm going to transition to our board chair, Trey Flynn. And actually, I'm going to actually introduce Trey Flynn's friend. That's hard to say, but Chris, maybe you have a little something to say for the folks tonight.
Hi, I'm Chris Kirkpatrick from NSYNC. I want to thank you for your work tonight to help conquer CHD. Friends of mine, Trey and Nicole, lost their son Holden while he was waiting for a heart transplant. Your support tonight will help us prevent deaths and improve lives. No family should have to experience the devastating loss of a loved one due to heart defects. Thank you for your support.
Thanks, Chris. I mean, come on, we have NSYNC member on there, Trey. I mean, you guys are friends with an NSYNC member. That's pretty impressive. So now I'm going to introduce Trey. So Trey Flynn and his wife, Nicole, are great friends of ours. Trey's our board chair, and he wants to come tonight and tell a story about his family and how they got on the CHD journey as well. Trey?
Thank you, David, and good evening, everybody, and thank you for joining us in these very strange times. As you can clearly tell, I am in my son's playroom. That's because we are in a different world. My name is Trey Flynn, and I'm the board chair of Conquering CHD. I'm also proud to call myself a hometown Orlandonian. I've lived here almost my whole life, as has my family, for over 50 years. In 2011,
disease. Through 4 operations and multiple interventions, my wife Nicole and I watched as he fought a very difficult battle. It was witnessing that first smile after each operation that will forever be one of those memories I'll cherish. And we lost Holden in January of 2014. But that didn't mean his fight was over. Nicole and I picked up the flag and made it our goal to conquer CHD. We were introduced to David and Amy and what was then called Pediatric Congenital Heart Association. We rallied around that. We went to Washington, D.C., and we told our story. We've been to transparency conferences to share our story and to give our input. Just because we lost Holden didn't mean the fight was over. And it's important because every day we live is a day we live for Holden. Your support tonight will ensure that children like Holden become more and more of an anomaly, and that the disease known as congenital heart disease is beat back. Tonight, we thank you for joining us. Tonight, I thank you for helping us conquer CHD.
Thanks, Trey. And, appreciate your support as always, your family. Holden's story will continue to go on forever. And, everybody who's been to the in-person event has heard Trey tell that story in one way or another. And it still impacts me to this day because as a parent, that's the thing I'm worried about. And I just appreciate their strength and their encouragement that they give other parents still to this day in honoring Holden's life. So thank you again, Trey. Now I want to tell you, we're really proud of each hospital relationship we have, one of which is Nemours. Here's Dr. Dulani with a special message for you all.
Good evening. Thank you for joining us tonight for Conquering CHD's virtual gala. My name is Gal Dulani. I'm the Director of Pediatric Cardiology at Nemours Children's Hospital in Orlando. On behalf of everyone at Nemours Children's Health System, I wanted to welcome you to the gala tonight. Nemours Cardiac Center offers multidisciplinary care for children with cardiovascular disease, both in Florida and in Delaware. Nemours has been working closely with Conquering CHD for several years, offering guidance through the Medical Advisory Board from Dr. Peter Werden and Dr. Erica Sood. It's my honor to be here tonight celebrating the work of Conquering CHD with you. Although we cannot be together in person this year, we are thrilled to partner and celebrate with you virtually. The collaboration, the research, and the dedication from everyone tuning in tonight is vitally important and will absolutely help Conquering CHD now and in the future. Caring is contagious, and together we can make a difference.
My daughter's diagnosis is tetralogy of Fallot. It's a condition of 4 heart defects. We had tetralogy of Fallot with absent pulmonary valve leaflets. So we had 5 problems.
Not having many answers from our specialist in Panama City, it was a relief once we got to Nemours and talked with Dr. Mehta and her staff. We all felt a lot better about the process and the condition.
Once we were told everything would be okay, but we had to have one big surgery, we prepared ourselves and we were ready to go forward. That's what we asked our cardiologist, was like, where would you send your child? And Dr. Mary Mehta said, Dr. Werden.
Surgery day was very tough. I mean, even when we pulled down to Orlando and seeing the Ronald McDonald House, our hearts kind of sink because we know it's real, it's about to happen.
So we had open heart surgery, which is huge surgery, no doubt. The recovery is actually quite amazing. They're pretty resilient and strong.
Yeah, Dr. Werden is an amazing surgeon. He did an amazing job. We couldn't thank him enough.
Right now, we got discharged from the hospital after 4 nights, and we're on a diuretic Lasix just by mouth. And then we give her Tylenol, infant Tylenol as needed. She will go on, she's a normal baby.
She'll be able to do everything like anyone else would be able to do, and she will be okay, and she'll be a normal kid and grow up to be a happy adult. And I know she's got a big brother who will be looking after her too, so.
If I could tell any mother what to do is not to Google.
Yeah,
Dr. Mary Mehta told us everything we needed to know, and we put all our faith in her, and she did lead us in such a great direction.
Conquering CHD realizes that in order to help more kids with congenital heart disease, we must partner with some of the health experts in America. Now, we have strong relationships with 50% of the pediatric health centers in America. And tonight, we must recognize some of those. Nemours Children's Health System, Orlando Health, and Avid Health for Children. Thank you so much for your continued support.
Thanks, Johnny, again. Again, I just want to just emphasize that your support matters so much this evening. There are multiple ways to donate through the auction platform, the donate button at the top of conqueringchd.org, and by texting. Please give as much as you can and as often. This money goes directly to the patients and families through our programs, and those programs are so vital to making decisions for the health care of either their children or patients themselves. So we appreciate the donations tonight. Okay, now I want you to grab a tissue. This is a little emotional, but our board member, Callie Cheeroff, wants to share her story of her son, Theo.
So after I had Theo, he was taken to the ICU right away, and we put his life and his heart in the hands of a surgeon who we love and care about, and he's the most amazing miracle worker in the world. So, but it's really hard when you have to do that, and no one can prepare you for what you see afterwards. And Theo lived, and he was doing okay, and he just had complication after complication, and he fought. He fought really hard. I wanted my son to have a quality of life that he didn't. He never saw the outside of his hospital room. I just couldn't see him like that anymore. So we withdrew care and said goodbye. And we've been trying to do everything that we can to honor his name ever since. This organization gave me the tools and the ability to give back to the community, and I don't think I would have been able to have the impact that we have without them and without their support. So I'm very grateful for that, and I want to keep supporting the mission and being a part of this organization.
Your gift of $500 can help families like Callie's who don't know where to turn. Your gift will provide 24/7 access to resources and information to help patients and families make the best medical decisions for themselves. Please consider a donation of $500. While we appreciate Callie's story, I'd like to also feature Trinity. Let's hear from this amazing young woman.
Well, I was born with ventricular septal defect, and my entire life I've always been around medical professionals and in hospitals, and my mom also, she was a nurse for a while and she still works within healthcare. And so seeing all of these people and hearing all these stories have inspired me to also pursue that same career. I have committed to Western Carolina University, and I'm planning on majoring in emergency medicine. So that's just, I'm going to get my bachelor's in that and become a paramedic for about a year, and then I want to study for my MCAT over that gap year and then attend medical school to become a cardiothoracic surgeon. So as a CHD patient, I really hope for the future that children and families affected by CHD, no matter where they live or how much money they make, can have the same access to quality healthcare, education, and support. Well, I was born with...
Wow, isn't she such an inspiration? She doesn't let her defect define her, but instead she gives her personal mission to help other people with CHD like herself. All patients, no matter what their age or race or where they live, should have top-notch quality health care. Your gift of $250 will give free access to hospital data and information that all patients and families deserve. CHD is hard to understand. Your gift will fund a brand new tool that shares hospital outcomes in a way that is easy to understand. This puts the power back in the patients and families' hands where it belongs so that they can make the best quality medical decisions. Help patients feel confident in their own medical care. Help make their plans for the future, like Trinity's, become a reality. Thank you for your gift of $250. So if we think about the $100 level, we can invest in research. Claire is an adult living with congenital heart disease, but she's also the mom of 2 children with congenital heart disease, the whole family. Libby, age 3, had open heart surgery last year. So you can imagine how important research is to them. Families like Claire's are at higher risk for complications from things like the coronavirus that we've all been impacted with during this pandemic. Research is the key to saving more lives. Let's take a minute to hear from Claire.
We need to understand CHD better, and research is critical to this. From diagnosis to treatment to prevention, your support will drive continued research efforts, help to empower the voice of patients and families like ours, and it will help save lives. Gideon and Libby and I will thank you.
They're so cute. So a gift of $50. At Conquering CHD, we believe patients and caregivers should have an active role in research, and Claire is actually very involved with our research programming. We provide opportunities for people like her to be directly involved. Patients and doctors can work hand in hand as we are conquering CHD. So thank you again for your $100 donation. Now we can move to $50. A gift of $50 will cover almost 2 hospital care kits given to children and adults in the hospital. It can feel so isolating being in the hospital anytime, but especially during this pandemic. Care kits can provide comfort items like Echo the Owl, travel-sized toiletries, and educational resources to help bring comfort and support during such an intense time. A local family, the Frosts, received one of these kits in the hospital. You can see Emerson the cutie received her Echo the Owl doll, and she still sleeps with it every night. Provide comfort, support, and community to another child or other patient right now with your $50 donation. Oh, you guys are all so amazing. Thank you for your donations and your generosity. You have impacted the lives of many families and patients by giving them the resources, community support, and investing in their futures. Thank you for your generosity. David?
Yeah, thanks, Amy. And whether it's $5, $10, $25, whatever it might be, your recurring donation, if you want to make a recurring donation tonight, it'll make a lasting impact to our patients, because CHD doesn't stop. Like we've talked about this whole night, CHD happens so often. 1 in 100 people are born with it. It's the most common birth defect. 40,000 kids are born with it every year. There's more than 3 million people in the US alone living with congenital heart disease. You probably know somebody with congenital heart disease, even if you don't know it. A donation of just $25 a month could sponsor 1 patient, 1 family who feels isolated and alone. Your gift will provide resources to families in the hospital or looking for answers. The answers that we talked about with the guided questions with the hospital navigator. Please consider a monthly donation of $25 or a gift in any amount. Your consistent support in this way will directly impact those in the hospital who need it most. And it is mostly, it's really appreciated that you guys are doing that, because it makes a big difference in their lives. Now we're going to switch over to maybe the thermometer again and see how we're doing. Can they pull up the thermometer for us and see? Wow.
Holy cow.
Wow, we started out with like 26,000. Now we're at 44,310. That's amazing. So we're a little less than $6,000 from reaching our goal. Please help us get that the goal tonight, everybody. Please, if you can bid as much as you can and often. Again, the silent auction is still ongoing. You still have a little while to go on that. Please donate often. You can go to our website as well and go to the other avenues for the donations. So please continue to do that. We have a couple more local shout outs and messages for us tonight. So take it away, guys.
Hi, it's Mark Daniels, voice of the UCF Knights. I'm here tonight because did you know there is no cure for CHD? It is a lifelong disease that requires ongoing specialized care. There are more than 3 million people living with CHD in the U.S. In fact, there are now more adults with CHD than children. To all those patients and families in Central Florida affected by CHD, you are not alone. Together, we are conquering CHD.
Hey, I'm Johnny Magic. As we begin to wrap up the evening, remember earlier I told you to write those words down and it was going to write out a secret phrase. Well, do you have that secret phrase? Are you ready? And now you're asking yourself, well, what do I do with it? Well, hold on, I'm going to tell you. Write this down. You're going to email it to us at secretphrase@conqueringchd.org. That's secretphrase@conqueringchd.org. You have until Sunday night, November 1st at 5:30 to get it in. And then on Monday, we're going to pick a winner through email and someone's going to get a $50 Amazon gift card. It could be you. Thank you for your continued support in conquering CHD. Thank you so much.
Wow, thanks everyone. A sincere thank you to everyone who has been giving so generously tonight toward our goal. A reminder that the auction closes at 9:30 Eastern time, so get those bids in. Don't forget to check back to the homepage of the website of the event site so that you can learn how to pick up your items when you're a winner in the end. Keep giving and keep bidding. You can text to donate to make it easy. Rebecca, can we take one more peek at how we're doing towards our goal? I am blown away, you guys. That is just amazing. What a fun night, and everyone's been so incredibly generous. Let's see if we can't bump up that goal. We're just so close. We have a couple more hours of the auction tonight, and you can feel free to text to donate throughout the rest of the evening, and let's reach that goal.
Yeah, thanks, Amy. So everybody, thanks for your generosity tonight. It's been, a quick night. We usually have a dinner when we're out together. We can talk before and after, and we can't wait until we are back, hopefully in 2021 in person, so we can all see each other and talk about how thankful we are to be in the same room. And I think it'll mean more even in this next year if we can be together. So thanks for your generosity and support this evening as we think of Callie, Trinity, the Flynns, Emerson. Together, we are conquering CHD. Remember that. Good night, everybody. And please keep bidding often and as much as you can. Thank you for your support. Have a good night.